Surgical instruments must be wrapped before they are sterilized in the autoclave. The purpose of wrapping an instrument is to protect it from recontamination during handling and storage. The medical assistant is responsible for selecting the proper size wrap for each instrument and wrapping the instrument using proper technique. The wrapping material consists of a substance that is not affected by the sterilization process. It must allow steam to penetrate, but prevent contaminants from entering during handling and storage. Individual instruments are usually wrapped with either sterilization paper or with a pouch. If a minor office surgery setup is being wrapped, such as a setup for a sebaceous cyst removal, a double layer of sterilization paper is often used. Muslin can also be used to wrap large packs. The procedure for wrapping using muslin is the same as the technique for wrapping using sterilization paper. The medical assistant will show you how to wrap an instrument using sterilization paper. Begin by sanitizing your hands. Assemble the equipment. You will need sterilization paper, a chemical indicator strip, and autoclave tape. Check the expiration date on the sterilization indicator box. If the sterilization strips are outdated, do not use them as they may provide inaccurate results. Select the appropriate sized wrapping material for the instrument being wrapped. Place the wrapping material on a clean, flat surface. Turn the wrap in a diagonal position to your body so that it resembles a diamond shape. Place the instrument in the center of the wrapping material with the longest part of the instrument pointing toward the two side corners. If the instrument has a movable joint, place it in a slightly open position so that steam will reach all parts. Also, heat exposure can crack an instrument at its weakest part if it is left closed. A gauze square can be used to hold the instrument in an open position. The gauze is placed between the blades of the instrument. Place a sterilization indicator in the center of the pack next to the instrument. When the pack is opened, the sterilization indicator will be changed in some way if the process was effective and the item is sterile. With this indicator, an O is stamped on the indicator. If the sterilization process is effective, a K appears next to the O to form the word OK, along with an arrow pointing to the word OK. If the sterilization indicator does not change appropriately, the item is not sterile and must not be used. Fold the wrapping material up from the bottom and double back a small corner, creating a flap. This flap lets you open the pack later on without contaminating the instrument. Fold over one edge of the wrapping material and double back the corner. Fold over the other edge of the wrapping material and double back the corner. Fold the pack up from the bottom and secure it with autoclave tape. After you remove the pack from the autoclave, the chemical on tape changes from white to black, indicating that the pack has been through the autoclave cycle. This prevents mix-ups with packs that have not been processed. Autoclave tape does not indicate that the item is sterile. It only indicates that the pack has been in the autoclave and exposed to steam. Make sure the pack is firm enough for handling, but loose enough to permit proper circulation of steam. Instruments must be wrapped properly to permit full penetration of steam and to prevent contaminating them when the wrap is opened. Label the pack according to its contents. Mark the pack with the date of the sterilization and your initials. Dating the pack ensures that the most recently sterilized packs are stored in back of previously sterilized packs. Instruments may also be sterilized in disposable pouches. First, sanitize your hands. Assemble the equipment. Select the appropriate sized pouch for the instrument being wrapped. For hinged instruments, make sure to use a bag wide enough so the instrument can be placed in a slightly open position inside the bag. Place the sterilization pouch on a clean, flat surface. Label the pack according to its contents. Mark the pack with the date of the sterilization and your initials. Dating the pack ensures that the most recently sterilized packs are stored in back of previously sterilized packs. Insert the instrument to be sterilized into the unsealed open end of the pouch. If the instrument has a movable joint, place it in the pouch in an open position. A gauze square can be used to hold the blades of the instrument in an open position. Seal the open pack. Peel off the paper strip located above the perforation to expose the adhesive. Fold along the perforation and press firmly to seal the paper to the plastic. Make certain that the seal is secure by running your fingers back and forth on both sides of the pouch over the entire sealing area. Sterilize the pack in the autoclave. Most pouches have a sterilization indicator on the outside of the pouch. Make sure the indicator has changed appropriately when you remove the pack from the autoclave.